Hello, this is Anthony Rota, Member of Parliament for Nipissing-Timiskaming and Speaker of the House of Commons. With the COVID-19 pandemic having a major impact on our lives, I wanted to reach out to community leaders and business owners around the riding and check in on how they've handled the last year. We recently recognized Autism Awareness Day, and I'm joined today by two people to speak about that subject on a local level. I'd like to welcome today Corry Thomas, who is the Director of Clinical Services at One Kids Place, and Joanna Stitt, who is a behavior analyst. Corry, Joanna, nice to see you, and thank you for joining me today. Now, years ago, I remember somebody telling me that if you've met a person with autism, then you know a person with autism. It's such a complex issue, and it's such a complex condition. Maybe let's start with that question. What is autism and how does it really affect someone? Maybe Joanna, how about we start with you on that one?
Sure. So autism is a neurodevelopmental disability that an individual is born with, and it remains with them through their whole lifespan. So it can affect a person's ability to communicate and interact with other people, and it can result in a tendency for them to engage in repetitive behaviors or have very specific interests or ways of doing things. And like you said, when you've met one person with autism, you've only met one person with autism. It is very much so a spectrum. So everyone is unique, and the diagnosis will affect them differently. So one person may have relatively mild characteristics, and someone else might have very severe characteristics. An example of that is one person could potentially require an iPad in order to communicate with others using a text-to-speech software, whereas another person who has autism spectrum disorder may be able to communicate quite well verbally, but they fixate on one specific preferred topic, and they can monopolize a conversation and not recognize social cues from others.
I have a cousin whose son is autistic, and I know a few people who are autistic. And one of the things, like when I think of autism, I think of brilliance, just the amazing ability to remember, to concentrate, and to do things. And that would be in a highly functioning. But and I understand that some of the breakthrough treatments that are coming out are really allowing people to develop and really become parts of society, as opposed to being isolated or shunned. Maybe Corry, you can tell us a little bit of that, the treatment and how it's evolved over the years.
Sure, and I'm not a physician, but I can certainly speak to and maybe highlight some of the things that we're doing here at One Kids Place. So there have been strides forward in autism behavioral services and supports, and such as here at OKP, we piloted and adopted the Early Start Denver model, which really allows for very early intervention. So there's lots of research, and it's really, I think, ballooned over the last several years around earlier the diagnosis, the better. Earlier the intervention, the better return on our therapies. So that has really, we've really stepped into that ourselves to try and really drive that early intervention, and then we have our diagnostic, the work in our diagnostic hub in Northern Ontario, as well as our developmental clinic in partnership with our local pediatricians, and so forth, to really look at our developmental clinic, which an integration, collaboration of that really drives that gets us earlier diagnoses, which we'd like to continue to improve on. We do lag behind Southern Ontario a little bit, and there's all kinds of historical reasons that you're probably well aware of around services in the north, right? We do also, and Joanna sort of mentioned it a bit about the augmented, like the iPads and augmentative alternative communication, and so we have both those services here. So we have a augmentative alternative communication therapy service, and the collaboration between that and our staff in autism is really actually serving quite beneficial for some children and families. And so I think that it's that interdisciplinary, discipline and combination of research, as well as trying different types of therapies with different to see what actually works and how they best work together. And so I think that that's something we do very well, actually.
And that's one area that people often overlook or look, because like, I mean, you look at where it's concentrated. And as you mentioned, Northern Ontario is not downtown Toronto, unfortunately, or fortunately, I guess, depending on which way you look at it.
Yeah.
But the concentration of people allows more services to be had. But speaking of services, Joanna, the services provided to children and their families, and I do emphasize their families because it is the whole family that is dealing with what it is. And I was looking at a really interesting description of what the Autism Day represents, and is representing bringing awareness to the people who have autism, but also to their families who support them and love them. And that's a big part of it. Maybe Joanna, tell us a little bit about what's going on at One Kids Place and what kind of supports and programs you have for the people and their families.
Sure. So the Autism Services team provides services in different regions. So in Muskoka, Prairie Sound, Nipissing, in Northern Ontario, all the way up to the James Bay coast. And currently we are offering fee for service, and that includes occupational therapy, speech and language therapy, augmentative and alternative communication, psychological services, and behavior services. And in our behavior services, we have a variety of services within those that can support both the child directly, as well as the family and the caregivers, and even other professionals that are supporting the child. So we have, as Corry mentioned, the Early Start Denver model, which is an early intervention program for children with autism. And we also provide services up to age 18. And so we have individualized assessments and intervention programs that can support individuals to learn new skills or to decrease challenging behavior. And we have group services as well. And we do single session consult clinics or resource clinics. And actually, One Kids Place Autism team is working with the ministry and with other agencies and partners on a few new proposals. So an entry to school proposal, a caregiver mediator proposal, and a Northern Autism Services proposal as well.
Now, how has COVID-19 affected autism services at One Kids Place? Because I know, I mean, used to be you'd bring the whole family in. How is that working now?
Yeah, so it definitely has changed a little bit, as with other service providers and agencies. Our team and the other clinicians and staff at One Kids Place have definitely had to adapt the way that we work and deliver services. Many of us are working primarily from home. And so it's been a bit of a shift providing services through virtual means like Zoom. But we've become very creative and innovative with the way that we can deliver these services, because we want to still ensure that we're providing a high quality of service and meeting the needs of the clients and the families that we're supporting. So most of our services are offered now completely virtual, which has been a great shift. But we do also recognize that some services and intervention programs are better suited in person, and some clients also require in-person service. So One Kids Place is still open for in-person sessions as it's deemed necessary. And of course, we're following proper COVID protocol with doing the screenings and PPE and sanitizing everything.
Oh, perfect. And part of it is awareness and getting out there. And Corry, I understand there's quite a bit that goes on as far as getting support, getting awareness out there, fundraising. Maybe tell us a little bit about that. Maybe if there's anyone out there who wants to get involved, that might be something that can be helped with as well.
Sure, absolutely, for sure. Well, like they say, it always takes a village, right? So, so we have partnerships with local community groups like the Lions Family, Lighted Up Blue Day, and most recently, Carry All Builders, which has allowed for further awareness of the services offered in the Nipissing region, as well as valuable funds to help augment our equipment and resource needs. So that's been great. In the past, our events have been hosted by the Lions Family and have been able to provide OKP with support to purchase things like weighted blankets, pressure vests, glow clocks, sensory lights, and soundboards for our snoozling room. So those are excellent additional resources that sometimes aren't as easily funded through traditional means, right? And so it's really quite important for us to augment our core funding with to bring these kind of supports to these families and to these children. this year's campaign with the Carry All Builders, which was the sunglasses sale, which you're going to get a pair. We're going to have Catherine deliver them to you, hand deliver them to you. We'll make sure they're sanitized first. And they're going forward. Their sales from that are actually going forward to purchasing more vests and weighted blankets, as well as some more sensory equipment. So we really appreciate this current initiative for sure.
Well, and if you had to, this is going to be somewhat self-serving, because I know in Ottawa we have a certain MP from Edmonton, Mike Lake, whose son is autistic, and he has been an advocate, tireless advocate for autism and autism services, and just bringing awareness to autism. I think his son is in his late 20s now, and I remember when we started off, he was about 12 years old or so. So, but he's been pushing endlessly for that. I was just wondering if there's anything that you would recommend that maybe the federal government could help out with. I know it's more of a health issue that might be provincial, but there is that framework and there is stuff that we can do at the national level. What would you recommend?
Sure. Well, I do think there's a couple of things come to mind. One is, and I think this is more of a federal bailiwick, is around improving broadband internet access to facilitate virtual care and assessment in the North. And certainly now, as we start to work with more Indigenous communities as well, I think that both of those areas are possibilities, and really fall more in federal areas, as well as we have a lot of very high needs families requiring a significant degree of funding and services and supports related to a complicated, complex web of service options, right? In order to maximize the benefit for the child and the family, and then particularly as they transition into adulthood as well. So I think it behooves probably every level of government to kind of look at how best can we support the maximum contribution of these individuals. And as you said earlier in our interview, Anthony, that we're increasingly seeing that they can really make significant contributions to our communities and our as well. And I think we need to continue to move on that direction.
Oh, perfect. Good. No, it's good. It's good. And of course, internet service and broadband service is something that we're pushing forward, and it's been expanding, never as fast as we'd like, but COVID-19 has certainly highlighted the importance and the need for that to allow us to do what we're doing today. If nothing else, an interview and bringing information to people. Well, I think we're just about out of time. And I was just wondering, is there anything you'd like to leave us with before we head off?
Joanna? No?
No, just thank you for the opportunity to connect and increase awareness for autism. It's been nice chatting with you.
Yeah.
Oh, sorry. Go ahead, Corry.
Yeah, it's very nice meeting you. Thanks so much for your time. And we appreciate the opportunity to participate in raising the awareness. And again, you can reach us at autism@onekidsplace.ca or at info@onekidsplace.ca. We're happy to hear from anybody, whether they want to give us money, volunteer, have some great ideas that we can leverage. We are more than happy to speak with them.
Very good. Corry, Joanna, thank you for joining me today. It's been a real pleasure, and bringing awareness, a little bit more awareness to autism and what can be done and how we can help. But thank you again.
Perfect. Thank you.
Thank you.